So our next presenter is going to be Dr. Prakhar. He's going to present study of screen time in dry eye disease, indicators, corneal endothelium, and meibomian gland morphology.
Good afternoon, everyone. I'll be presenting my paper on to study the effect of screen time on dry eye disease indicator, corneal endothelium, and morphology of meibomian gland. Introduction: dry eye disease is becoming more of a public health concern due to its often underappreciated effects. Due to a chronically fragile tear film, exposing the corneal and conjunctival epithelium to the atmosphere can lead to inflammatory damage if not treatment is not received. Based on epidemiological studies, dry eye disease is primarily evaporative in nature and is frequently linked to meibomian gland dysfunction. Dry eye disease has been demonstrated to have less corneal nerves, and recent data shows in patients with neurotrophic keratopathy the presence of neurotrophic factors in every layer and notable alterations in every layer, including the endothelium was observed. There has also been evidence of notable change in the properties of corneal endothelial cells as well as endothelial cell loss in eyes with moderate to severe dry eye disease. Aims and objectives: first was to assess the effect of screen time on dry eye disease indicators, mainly TBUT and OSDI score. Second, to study the effect of screen time on morphology of meibomian gland. And third, to analyze the effect of screen time on corneal endothelial cell density. Material and methods: it was in prospective observational study. 2 patients groups were established. Group A with 40 patients with screen time at least 6 hours a day for a minimum duration of 1 year, and Group B with 40 patients with screen time less than equal to 2 hours a day for a minimum duration of 1 year. For TBUT, we scored less than 10 seconds as a threshold for the diagnosis of dry eye disease, and mild dry eye disease 7 to 9 seconds, moderate 5 to 7, and severe less than 5 seconds. OSDI scores: we asked each patient 12 questions, and OSDI score was calculated with the formula. The OSDI score ranged from 0 to 100. Normal was considered less than 13, mild 13 to 22, moderate 23 to 32, and severe 33 to 100. Meibomian gland morphology was performed using routine OPD instrument, autorefractometer. We used Topcon KR 8800, and for corneal endothelium we used clinical specular microscope. Results and observation: in our study, there was a female dominance present in Group A. As we can see, 1:1.5 ratio of male is to female was present, and in Group B, 1:1.2. For the comparison of TBUT, the mean value in Group A was 10.68, and in Group B was 14.75. So we can definitely see that more screen time, the TBUT test was effective. For the both eyes, right and left eyes. For OSDI score values, the mean OSDI score for Group A was 23.84, and for Group B was 13.11. We also observed that in Group A, more severe cases were present than in Group B. For morphology of meibomian gland, we can see that in normal patients, Group A and Group B, Group A had less normal patients and then Group B. The altered morphology we noted in following parameters: short meibomian gland, thick, dropouts, or distorted. The frequency of these changes were also more in Group A. For comparison of corneal endothelial cell density, for right eye, we can see a slight less corneal endothelial cell count in Group A compared to Group B, but the value was non-significant. But in left eye, it was significant. Discussion: the use of video display terminal has increased dramatically as a result of global information age, which is also altering the lifestyle of the people, young and old. It is acknowledged that the using of visual display terminal increases the chance of developing ocular symptoms. In our study, female dominance is measured as male to female ratio was 1:1.5. Similar studies were reviewed, and in 2018, a study showed that greater prevalence of dry eye disease in females compared to males. The TWAT score, the dry eye, the mean value of dry eye was less in group A compared to the group B. The same was noted with the OSDI score, and the values were significant. The mean OSDI score was more in group A compared to group B. Meibomian gland morphology, the group A, the endothelial cell count, the group right eye, group A and group B, the significant value were noted in the left eye. Conclusion, our research indicated that the patient who used screen time excessively has higher risk of acquiring dry eye illness. Additionally, a favorable association is also established for meibomian gland morphological changes and reduced corneal endothelial cell density in moderate to severe dry eye disease.
What are the grading system you are using to categorize the dry eye
Sir,
in digital eye syndrome?
for different tests we use different. For T-BUT we used more than 10 seconds as normal, so 7 to 9 seconds as mild, 5 to 7 seconds as moderate, and less than 7. And
In your study, have you correlated the things with the surface analysis with the endothelium cell count?
Sorry, sir?
Have you correlated in your study the
Yes, sir.
OSS study with the endothelial cell density?
Sir, few studies were, not much research had been done with the corneal nerves and the association of corneal nerves and dry eye disease. Two studies I think I reviewed in my article, which showed slight significant correlation between dry eye disease, moderate and severe cases. With
on the basis of the severity of the dry
Yes, sir.
eye,
more severe cases, more corneal nerve decrease and endothelial cell count decrease was observed.
okay.
Yes, sir.
Dr. Prakhar, how did you ensure that the other confounding factors like occupation of the patient, activities that they're involved in, more of indoor or outdoor activities, that can also affect their ocular surface index?
Ma'am, any ocular pathology or previously diagnosed dry eye disease cases we excluded in our study. Only normal patient that came in our OPD, we included from that patients only. Like any previous history of surgery or previously diagnosed dry eye disease or patient using lubricants, we excluded from the study.
Okay, thank you, Dr. Prakhar, for nice presentation.